Next question is, do you use a laser for crown lengthening or other cases? No, I don't have a laser. Some people do laser crown lengthening. It seems to work quite well. I don't. I've managed to live this long without it. Maybe one day I will. I don't like the fancy hard tissue lasers because they're very expensive for something that does a very small number of things. So maybe like the soft tissue laser is okay, but then to get a laser that can actually remove hard and soft tissue, they're generally quite expensive, and then you're in the situation where you have this laser and you feel an urge to do things to justify having it. It's a little bit like if you have an in-house milling machine, suddenly things that might be a small filling have a temptation to become an onlay or an inlay just because you have a milling machine sitting there. So the answer to the laser question is no. I try to focus more on technique than on equipment. Equipment is important, but technique is more important. So most of the money that I've spent in the last 12 years has been on improving my technique, improving my skill, not so much buying new equipment. There's a few bits of equipment that I'm very glad I have. Air abrasion I can't live without. A cone beam I can't live without. A camera I can't live without. So they're like but I mean, I don't have an office full of fancy tech. Okay, I don't want to have an office full of things that amortize quickly.